morning, ladies and gentlemen. I request all of you to please be seated to watch a corporate video on MEDI BIZTV.
With an estimated 9.2 million physicians, 19.4 million nurses and midwives, 1.9 million dentists and other dentistry personnel, 2.6 million pharmacists and other pharmaceutical personnel, and over 1.3 million community health workers present worldwide, the global healthcare industry is the world's largest and fastest growing industry. But despite the resourcefulness of this industry, it still lags behind in this era of globalization. Every day, every year, 2 billion people around the world face death threats. 2 million people die of TB. 11 million children under 5 years of age die due to diarrhea, malaria, measles, pneumonia, and HIV/AIDS. And more than 500,000 women die due to pregnancy and childbirth. Though recent awareness programs by organizations like WHO and UNESCO have helped bring down the global mortality rate in the most remote corners of the world, it is stated that over the next 10 years, global deaths from chronic diseases are expected to rise by 17%. With no defined medium to spread awareness to the general public, the global healthcare industry is certainly up for a rough patch. To surmount the current challenges of educating the global public on the importance of hygiene and well-being, MEDI BIZTV, the world's first global maritime TV channel, in association with Ares Marine, the largest ship design consultancy firm in the Middle East, are launching MEDI BIZTV, an international TV channel dedicated to the medical fraternity. MEDI BIZTV is a channel with global appeal, which can be enjoyed and savored by individuals of all ages alike. A core source of infotainment, it would help the common man understand the importance of test, treat and track and spread the message of good and healthy living. MEDI BIZTV, an international medical TV channel. Healthcare at your doorstep.
Ladies and gentlemen, the noblest of all services is healthcare. To relieve the pain and suffering of a person is considered as a noblest act of kindness. Healthcare awareness is on the increase all over the world. Today, with the launch of MEDI BIZTV, Ares Group of Companies is entering the healthcare sector. With the vast experience and technology that Ares has in the electronic media, MEDI BIZTV is expected to connect entrepreneurs, healthcare professionals, and common people to the vast opportunities and facilities in the fast-growing healthcare sector. On behalf of Ares Group of Companies, I extend a warm welcome to Dr. Prem Nair, the Medical Director of Amrita Institute of Medical Sciences, Cochin. I request you to please be on the stage, sir. The CEO of Ares Group of Companies, Shri Sohan Roy, is present here. I extend a hearty welcome to you, sir. Request you to please be on the stage. Shri Satish Kumar, the Director of MEDI BIZTV, is present here. I extend a hearty welcome to you, sir. Please be on the stage. Thank you. On behalf of Ares, I extend a hearty welcome to all of you who are present here today. Thank you. Now, I request Shri Satish Kumar to deliver the presidential address.
Dear Dr. Prem Kumar, and dear Son Roy, and my dear friends, today is a very auspicious day for MEDI BIZTV. Basically, health is a human right. The WHO's efforts on health for all by the year 2000 could not reach its goals till today. You know why? Because it did not distinctly separate itself from the global business with disease. The WHO focused instead the administrative healthcare changes rather than taking the advantage of the global advance of technology and medicine. Now, we do need an intervention to take forward the Vision 2020, Health for All. After the MEDI BIZTV logo launch on 15th May 2013 in Crown Plaza, Delhi, today we witness another major milestone in the history of Aries family with the inauguration of our MEDI Biz office in Kochi. As evident from the video presentation just played, you know, healthcare is one of the most significant ever burgeoning industry globally in terms of its impact on GDP as well as the role in developing the healthy nation. As all of you know, healthcare system embraces every walk of life, right from the very moment of conceiving a baby in the mother's womb, or even before with the infertility treatment, and from the very first breath of a baby in this universe, to the last breath of the person, healthcare plays a pivotal role. Besides, healthcare also extends to veterinary science and nutritional biology. Healthcare system in India claims 6% of the GDP and employs around 9 million workforce. In other nations like USA, 20% is the GDP claim on healthcare. Again, healthcare is a multifaceted system, spreading its roots to basic branches of science like Ayurveda, Homeo, Siddha, Unani, modern medicine, yoga, health insurance, drug manufacturing, discovery of new molecules, clinical trials, cosmetics, etc., etc. And again, modern science encompasses a lot of subdivisions like infertility, neonatology, pediatrics, geriatrics, dentistry, and the list goes on, like oncology, head and neck, ENT, dermatology. So every day a new super special offshoot comes out. Among these, every discipline has its own independent procedures and identity. And integration of these multidisciplinary systems of healthcare is the main challenge of the day. For example, chemotherapy, you know, is a very effective tool for cancer as on today. But the severe side effects of chemotherapy is really a challenge. Our Ayurvedic treatment, intervention of Ayurveda, has a lot of supportive effect on the chemotherapy side effects. Of late, there was a discussion in Shornur with our Dr. Gangadharan as well as Dr. Vigumar from Coimbatore Adi Pharmacy. There was a meeting of the first time in India, an Ayurvedic leading oncologist sitting with a Ayurvedic physician. And the thing is that this is the only way to have perfect patient healthcare. So, such multidisciplinary approach for our patient care has to be developed to the whole world. And MEDI BIZTV, the brainchild of our dynamic CEO of Aries Group, Sohan Roy, is a major bridge to integrate the above multiplicity of healthcare system and scenario and fill the gaps among different disciplines of the healthcare. As a corporate, we are well aware of our interest conflict because patient health, public safety, public awareness, and public professional education will be our prime focus. You know, today in Mathrubhumi and Malarama front page, there's an ad you have seen. സന്തോഷവും ആരോഗ്യമുള്ള കുടുംബത്തിന് എന്ന് പറഞ്ഞിട്ടൊരു ആഡ് ഉണ്ട് ആ ഒരു ക്വാർട്ടർ പേജ്. ആക്ച്വലി ഇറ്റ്സ് എ ഡ്രഗ്, ഇറ്റ് ഈസ് എ അഫ്രോഡയാസിക്. സോ എൻ അഫ്രോഡയാസിക് ഡ്രഗ്, സെക്സ് സ്റ്റിമുലന്റ് ഡ്രഗ് ഈസ് അഡ്വർടൈസ്ഡ് ആസ് ആരോഗ്യവും സന്തോഷമുള്ള കുടുംബത്തിന്. സോ ഹൗ ഹാർംഫുൾ ഇറ്റ് ഈസ്. അഫ്രോഡയാസിക് ഈസ് അഡ്വർടൈസ്ഡ് ആസ് എ സന്തോഷവും ആരോഗ്യമുള്ള കുടുംബത്തിന്. നമ്മളുടെ തന്നെ കുട്ടികൾ അവർ teenagers are taking a drug which is aphrodisiac. So such sort of interest conflict has to be compromised. So proper education of the stakeholders in healthcare is another major task to be undertaken. As many of our healthcare professionals are unaware of the ever-changing modern concepts and technologies, there will be a prime-time program meant for each country depending on their time zones, where public awareness as well as professional awareness programs will be telecasted. Each major offshoot of healthcare will have a status or share in this group. And MEDI BIZTV will provide a common platform where all the disciplines can interact and integrate their interest, which is essential for ultimate patient care. There are very important health aspects to be addressed today for total healthcare solutions, and a few of them can be mentioned here just for the sake of our interest. The whole world should benefit from the age-old, rich, traditional Ayurveda science, then medical tourism, etc. And these unique scientific principles has to be brought to the limelight of the world. For example, we have $2 billion business for medical tourism. Medical tourism is Ayurveda, then dentistry, etc. in India, going very high in vogue. Then manufacturing companies should have a popular and significant influential medium for advocating their usage of new drugs and new molecules. Public should be aware of the do's and don'ts of lifestyle diseases and the aftermath. 40% of the diabetes patients actually need no medicines. 45% of the hypertensives, BP patients, they don't need any medicines. Obesity is one of the main issues of today. So if you can have your lifestyle changes, you can have a lot of effects on this. Even, my case, I was suffering from high BP in 85. 28 years back, when I had a small trouble, I went to a doctor in Perumbavoor. Dr. Shoguma told me, you have a high BP, 130/95, so take drugs. He gave me 4 drugs that he gave me. And I have not taken a drug. I have switched over to yoga and meditation. And today my BP is 80/110 in spite of 25 years after that incident. So once I have been switched over, I had taken drugs that day. I'm very sure that within 5 years I would have been diabetic also. So medicines is not the only panacea for our major diseases. Then overdosage of drugs many times, self-medication, etc. has to be dealt with. Public should be aware of the menace of the self-medication as well as our medication. For nowadays, we know normally for any pain, we have painkillers from the counter, which can cause you ulceration of the stomach. So these are all things which should be taken care of. And then nutritional science and food and nutrients is another major focus to be addressed to the whole world. For example, chemicals, insecticides, colorants of the food industry, it can cause cancer. Maida, our Kerala's national food we call parota. It contains maida. Maida, for the manufacture of maida, there is a chemical called alloxan. Alloxan is a chemical added to maida and to white bread to increase luster and that beauty part of it. So this, whenever you purchase any bakery item with the luster, please understand it contains alloxan. Alloxan is a chemical used in the laboratory to induce diabetes for animals to test our drugs. So a diabetic inducing agent is being taken in our menu by using maida and white bread. So this sort of antisocial activities has to be reduced. In the same way, acrylamide is another cancer-causing chemical which is generated when a starch is boiled or fried in oil. For oil, it goes up to 280 degrees for the smoking temperature we call. So above 120 degrees, if a starch is boiled or fried, it can create acrylamide. Even that oil will decompose to make acrolein, ultimately causing acrylamide generation in the foodstuff. So whenever you eat very tasty finger chips having 280 degrees multiple fried, definitely there will be high percentage of acrylamide which can cause you genetic disorders as well as cancer. So such basic nutrient or what we call food issues has to be addressed the whole world. Then we have nutrient deficiency like magnesium, chromium. Chromium and magnesium is a basic element of diabetes. Whenever there is a deficiency of chromium, magnesium in the body, you will have glucose intolerance. Zinc, then manganese, selenium is another element have a lot of effects on goiter, our thyroid, as well as then cancer. So how to how to have our food incorporating these elements is another scenario. So same way, the new surgical procedures and major applications of modern technology should be visually available to the stakeholders. Threats about microbes and epidemics should be available to the common man. Then professional and smart visual marketing techniques could be provided for manufacturers through web TV, where you can avoid expensive, marketing executives. Because, even Cipla or Glaxo can have a educated program for the professionals. Even you can have a password protection also for that. Like that, our MEDI BIZTV can play a good role in marketing of new drugs. Then, facilities of leading world-class hospital institutions to be brought to the needy people, because we have a lot of people like Amrita Hospital or chain of hospitals we have. Then we have we have medical institutions all over the world. So the whole world should be aware of the facilities of Amrita Hospital in Kochi, in Kerala. So this is a good medium for us to propagate the interest of the industry and healthcare. Like again, WHO and the many nations have a global media partners they need to implement their policies and program. So our MEDI BIZTV can be a tool for that. So global sharing program on new medical initiatives like medical diagnostic imaging, generic pharma industry, contract research, contract manufacture, wellness and preventive techniques, fighting obesity, smoking cessation, medical insurance issues, health-related manpower resource management, trauma care management, etc. has to be advocated. So in short, what I would like to conclude is that we need a powerful, effective global tool to interact and benefit all the stakeholders of the healthcare system, including the patients, the public, to bring them under one umbrella, the MEDI BIZTV. So let us join hands to welcome this novel venture, and let us bring Vision 2020 Health for All into a reality. All the best. Thank you.
Thank you, sir. Now I request Sri Sohan Roy to kindly address the gathering.
Dr. Prem Kumar, Mr. Satish Kumar, my dear colleagues and friends. Starting a TV channel is not a big deal nowadays. Every other day a channel is being launched somewhere in the world. But making a platform for the integration of an entire industry or a community using a television channel, it is not so easy. It's our own experience. When we started 6 years back with the same concept of integrating the maritime community for the first time in the world, there was nobody there to lead us. That concept was created, we designed it, we made a path. Now that R&D project is in the final stage for the commercialization. In 2006 itself, when we announced the MEDI BIZTV project, in Cochin itself we announced that our next venture will be the MEDI BIZTV. But it took 6 long years for us to make it a realization. Now all our tools required for this integration process is ready. Now that integration tool is more than sufficient to go for the integration of any field, whether it is medical field or a legal field or an engineering community field, IT field, because we have the tools right now. The same softwares, same platform, the same methods what we have used for the integration of the MEDI BIZTV. For example, the concept of IMC, International Maritime Club, where using a television channel, we could brought more than 230 maritime organizations under one umbrella. It was a long process. Now IMC has become the world's largest maritime organization. The same concept we are going to introduce in the medical field also, because medical field is a disintegrated field, I should say. We have doctors got their own community, pharmacists they got their own community. Everywhere there is no platform where they can join hands, because there is a common goal, that is the good health. That is what the public requires. Whether it is through the allopathy, whether it is through the Ayurveda or Homeo, whatever it is, end of the day, what we need is proper health. I have enjoyed the benefits of allopathy, Ayurveda, homeo at various stages for various things. I never felt that there is a difference. For each disease, someone is a specialist. What we need is a common platform where we can be guided to use which one is better. We don't know because ignorance is the main hurdle in front of us. Everyone is suffering out of this ignorance. So a television media can surely, I won't say that it can put a full stop. At least it can enlighten you, or it can put some light towards this ignorance. Even just like Mr. Satish Kumar said, I was also experiencing the same thing, because even till last year in Aries group itself, almost everyone was totally least bothered to go for the medical, the basics of medical knowledge, what we should know. We were totally ignorant about these things. But when we announced this year as the medical year or health year, we started looking into the various aspects, various potential of the medical concepts. Even you all know that I could reduce almost 15 kg in 45 days, and many people, many of our staff are following the same footsteps. And even I was affecting with the same problem what Mr. Satish Kumar was facing, the high BP. Mine was quite high. It was 110, 160 range actually. I visited almost several, I should say that more than 10 doctors I used to consult. But and I have been taking the drugs for almost more than 10 years. Now, after reducing this weight, my BP has come down to 80, 120. So it is till I was going through this process, I was totally unaware that it is absolutely possible to get out of these medical issues like this. So through this TV channel, we need to educate the public. We need to educate even the educated community, because I am 100% sure that even the educated communities, they are not much aware about the medical things. So we believe that this medical TV concept can do a lot of things in this awareness program. And same way, the integration process, it can do a lot of other things, just like what we have done in the marine sector, the AIMRI concept, here is Maritime Research Institute. Same concept we can introduce in the medical field also. Same, we don't need to change the name also. AIMRI stands for Aries International Medical Research Institutes. The same concept we can introduce here also. A lot of, because many people who are working in the industry, they have high talent, they got several concepts. What they need is a platform where their innovative concepts can be made it into a practical solution or a product or a concept, so that the next generation can make use of such new concepts. So that is what AIMRI stands for. And so there are several other concepts. In the P25 concept, same thing we can introduce in the medical field also. Whatever we have developed, all the 25 research products or concepts we developed through the P25 project, same thing we can introduce. Maybe it took 6 years for the Marine BizTV to develop the concept, but the medical field, I don't think we need another 6 years, because already the base is there. So maximum 3 years it will take for the realization of this P25 concept in the medical industry also. I'm 100% sure that before these 3 years itself, this commercialization of the entire concept will be ready. And what we have planned is to have 36 pillars for this TV channel. 36 pillars means we have categorized the entire medical field into 36 categories. So each share, there are 36 exclusive shares to support this channel. So each field will be having an exclusive share, and that share can be given to only that field. That means that particular shareholder will be representing an entire community, because we are not looking for a financial support from that shareholder. Actually, what we need is their technical support, their moral support, the entire community behind them should support the concept. Then only this integration process will be materialized. The same team will be supporting MEDI BIZTV also. Hope this venture will be a success in the near future, and let us pray for that. Thank you very much.
Thank you, sir.